Hello, my name is Dr. Asare Christian. I'm a board-certified physical medicine and rehabilitation physician and the founder of Ethan Medicine. Ethan Medicine is an integrative medical practice in Wayne, Pennsylvania that focuses on cellular health to address pain, improve performance, and health span. And today I'm excited to talk to you about emerging technologies in pain management. This is an important concept to talk about because, as it turns out, the current treatment that we have for pain does not work for many people. So if you're a patient who has migraine, fibromyalgia, rheumatoid arthritis, chronic back pain, musculoskeletal issues, they don't tend to respond to a lot of this treatment that we have. And there's all of these new technologies in the advancement of molecular science, understanding really what goes on in pain and technology. We are able to come up with different ways to address pain for individuals. This is what we're going to be talking about. So here's a quick outline of what we're going to be talking about. And first, we're going to talk about the problem of treating pain itself. Pain is a big problem, but it also turns out treating pain creates even a bigger problem that we're going to discuss. Then we'll look at some technologies that actually are available to our patients and come up with some conclusions. So when it comes to emerging technologies, we know that there's always advancements. And even now, as I speak, there's new technologies that are coming to the market to address pain. So in this context of emerging technology is technology that encompasses a wide range of tools, systems, devices to diagnose, treat, and alleviate pain. So when we're talking about all of those emerging technologies for today's discussion, we're going to be focusing on digital health and apps, neuromodulations in the areas of migraine, spine issues. We'll talk about wearables and bioelectronic medicine, a very fascinating area of medicine, regenerative medicine, and then also talk about some new technologies when it comes to surgery and surgical interventions. So first, let's talk about the problem of treating pain itself is a problem for our community and society, and we're going to be talking about that. So when it comes to treating pain, currently what we have is we have pharmacotherapy, which is the use of drugs to address pain problems. We also have non-pharmacological therapies. This include acupuncture, physical therapy, chiropractic, and other modalities. We also have psychotherapy, which is very important in modulating the affective component of pain. And then we also have specific interventions such as surgery that individuals can participate to help with that. So when it comes to pain, we know that pain is a huge public health problem in America. Pain affects 100 million people. This is chronic pain, not just regular pain. Chronic pain affects 100 million people in America, and it's more than the people with diabetes, heart disease, and cancer combined. So this is a big problem. We also know that one of the main ways that we treat pain, especially chronic pain in America, is with pharmacotherapy or with drugs. And when it comes to that particular type of modality, in one specific area with the use of opioids, we know that the burden and the misuse of opioids in pain management has led to a public health crisis, which costs more than $1 trillion per year. So this is a significant public health issue. And this is the question of what else can we do to help our patients manage their pain. And even when we look into the literature, when we look at the science behind how we treat pain with pharmacotherapy, the drugs that we have, there's a lot of literature that shows that these medicines don't work as well. So this is a Cochrane review looking at pharmacotherapy for low back pain. And in this study, looking about 22,000 individuals with all the drugs that we have, the authors concluded that they found no high or moderate certainty evidence that any investigated pharmacological agent provided a large or medium effect on pain intensity for acute or chronic low back pain. This is actually something that our patients are already aware of. I see patients who've tried every medicine and they still not have an issue. So we have to look at something different. And specifically to this topic, when we're talking about emerging technologies, we have to get clear on what are we trying to solve. Are we trying to solve the pain signal? Are we trying to address the underlying problem or inflammation? Are we trying to prevent pain from becoming chronic, which is a big issue? So these are all things that we have to think about in terms of emerging technologies. So we're going to talk about how these technologies work, but mostly, most of them focus on addressing the pain signal from the periphery. That is where the pain will start from, whether from the knee, from the back, and then also centrally, what's going on in the brain, and then other things that perpetuate pain. So anxiety and stress, all of that can make pain worse. So all of these technologies are trying to address all of these issues. And the ultimate goal is to prevent patients from developing chronic pain. So now let's start with wearable devices. These are things that individuals with pain will be able to wear to address their pain. And one specifically that we're going to be talking about, and in fact, there's multiple wearable devices. And one of the things I have to say before we even move forward with all of these technologies is that there's so many things out there, but today we're going to limit this to very specific things that has a lot of evidence and also has been around enough and has been validated to address our patient issues. So one of the wearable devices that we're going to talk about is something called Quell or iTens. This is something that has been validated for individuals that have fibromyalgia, neuropathic pain, muscle or joint pain. And how this works, or the mechanism of action, is basically delivering electrical impulses to nerve fibers to change the signal that is going to the brain and increase the body's way of making its own endogenous opioids or its natural painkiller. And when it comes to this type of wearable devices, they are relatively safe. The only thing that we have to concern ourselves about or worry about is sometimes skin irritation that can occur. And we also have to caution if anybody have a pacemaker or anybody have defibrillator, this is something that can be affected with electricity. So with all of these devices, anything that is sending electricity through the body, we have to be cautious of that. But otherwise, this is something that's very safe and it can help with fibromyalgia. It can help with neuropathic pain, and it has FDA clearance to help with those things. Now let's switch to talk about pain apps. There is multiple pain apps out there, and I'm really going to focus on one specific because this is something that has had a lot of science behind. And I've also used this in my patient population. It's very easy to use. And this is something that if you're a clinician, I will highly recommend that you address or look into these apps for your patient. Because when we talk about pain, pain has a sensory and an emotional experience. And in medical practice, what we are able to do effectively is addressing the sensory component of the pain, but not so much the emotional component. And without addressing those things, pain doesn't get better. So this is an app that really focuses on the cognitive side of how pain is processed, can help your patient address pain, not just pain, anxiety, and some of the other comorbid issues that goes on with pain. So one, we're going to talk about Wearable. Wearable is an app that I love and I give to all of my patients. And how Wearable works is really using the principles of cognitive behavior therapy, or specifically pain reprocessing therapy, which is a new way to really educate patients about the threat value of pain. Because when we talk about pain, in a simple way to describe it, pain is a signal attached to fear. So if we can educate individuals to be able to process this signal that's coming to them and evaluate the threat value, how fearful it is for me to have this pain, that this pain doesn't mean that something is very wrong, that actually can improve patients' experience of pain. So Wearable is a great app to explore. It's very helpful in reducing pain, enhancing mood and mobility, and it can also help clinicians to really help their patient to understand pain. Because one of the biggest problems we have with pain is that this is a subjective experience, and that the individual who's experiencing pain have to really come to understand the pain itself. And Wearable gives patients that. No significant side effect. This is something that's free that individuals can use for a certain amount of time, and subsequently they can pay for a subscription. But great app to explore. Now let's switch our attention to neuromodulation devices. And as the name implies, these are specific technologies that actually modulate how pain is processed in the nervous system. So pain is actually an output from the brain. And that is a little bit sometimes hard for individuals to understand. But actually, we know that when people have phantom pain, even though we've cut off their leg, they can still experience pain. So pain is always an output from the brain. So what we are able to do with some of this technology is to modulate the signal that's going to the brain and also modulate how the brain is processing pain. So specifically in this context, we're going to talk about some really great applications of neuromodulators for migraine. And then we can also talk about issues for spinal cord stimulators, something that maybe you are familiar with, that can also help with patients. So when we are talking about neuromodulation for the spine, there is specific types that are there. The names are out here: neurosensor, spinal cord stimulator. This is something that we'll actually put in the spinal cord, and it delivers mild electrical current to the spinal cord disrupting the pain signal that is going to the brain, and often require a trial period to see if this is going to work for you before we do it. In terms of its effectiveness, it's been noted to have more than 50% reduction in pain for most people. So this is specifically for people who have failed pharmacotherapy, who have failed other therapies, and this could be something that they can explore for people that have chronic pain. In terms of safety, this is relatively safe. We have to worry about the risk of infection. This is a surgical procedure to really implant this into the spinal cord. So there's some risk there, but again, this is an option for individuals that have spinal pain, leg pain that is not responding to current therapy. We can also look at specific innovations or emerging technologies in the areas of spinal stenosis. So when people have spinal stenosis or issue with the spine in the back, this is a very difficult condition to treat, where there's leg pain, there's numbness, and there is specific intervention, a surgical intervention, minimally invasive surgical interventions that can help individuals with that. So we have new technologies called Vertiflex, Colflex, and Minuteman G3. These are all minimally invasive procedures that can be done in the outpatient setting, and they address the signal or spinal stenosis with a less invasive way, which has been shown to provide good outcomes. There's been studies that have been done to really look at all of these devices and how they work. And there is scientific evidence that confirms the safety and success of procedures such as mild and superior, improving lumbar spinal stenosis care. So this is an option that for individuals who have spinal stenosis who want to avoid surgery, and sometimes surgery may not even be an option for them. Now let's talk about something that is quite exciting, and I'm quite passionate about this because I treat individuals with migraine. Migraine affects a lot of individuals in the world, and sometimes the medications may not be as effective or may have side effects. So this is another way to modulate the signal. There's multiple mechanisms underlying why we experience migraine. So there is devices specifically that's been designed to help address these problems. And these are all FDA cleared or FDA approved devices in the United States, as well as around somewhere in the world. So we're going to talk about Cephali. So Cephali is actually a device that you put on your forehead that stimulate nerves to address pain, and it's been indicated for both acute and chronic migraine prevention as well as treatment. So when you have migraine, how we treat migraine becomes a function of something that we use to prevent the migraine itself. And then we also use something, abortive therapy, something that you use to address the migraine when it comes on. So Cephali has indication for both prophylaxis or prevention as well as acute treatment. There is also gamma call. So gamma call is an interesting neuromodulator that we apply to the vagus nerve. And we're going to talk about the vagus nerve in other bioelectronic medicine that actually has a huge implication in how we address pain as well as inflammation. So the gamma call is a handheld vagal nerve stimulator for acute as well as prevention of migraine. It also treats episodic cluster headaches and prevent other hemicranial type headaches. There is also another device called Nerivia. Nerivia is actually a bandage that you can wrap around the forearm or the arm that has wireless wire band, and it's also indicated for acute migraine. This can also be used in pediatrics because a lot of times we can use medicines, and it works to shut off the pain valve of how pain is being transferred to the brain. And then another device is something called Relivian, which is a headset that targets the trigeminal nerves as well as the occipital nerve. So this is a great device that individuals that have migraine can look into to address their problems. And they are relatively safe. Again, if you have a pacemaker, we have to be cautious about how these things are used, but otherwise very safe to use for individuals with migraine. Now let's talk about the field of bioelectric medicine. This is quite fascinating, and this has implication not just in pain, but in cardiovascular health, in rheumatoid issues, in metabolic health, because this target the vagus nerve, specifically the ones we're going to talk about, which is something that is connected to a discovery called an inflammatory reflex. Inflammation underlies many multiple disease states in our body. And if we can target that in a healthy way, then we can really work on addressing a lot of the issues that individuals face. When it comes to bioelectric medicine, one of the clinicians who've done a lot of work and studies in this area is Dr. Kevin Tracy. And he has something to say about this that I thought was quite fascinating. And he said the possibilities to replace pills and injections with computer chips is right around the corner. So it's going to come a time where we're not going to be taking medicines anymore. Of course, there may be a place for it, but it's going to be quite limited where we can use chips and other things like that to address pain. So let's talk about bioelectronic medicine. And specifically, we're going to talk about a product that's come from SetPoint Medical and electrocore. We already talked about gamma core. So these devices work by modulating nerve activities to activate the body's natural pain relief mechanism. And it has been shown effectiveness in modulating inflammation as well as rheumatoid arthritis. So this inflammatory reflex can be modulated by this electrical implantation that we have on the vagus nerve to address pain, address inflammation, and improve other markers of health. Because when you target inflammation, then so many things in the body can be addressed. There's a lot of research ongoing still to really understand how well we can implement this into practices, and it's also indicate for specific patient population. So again, when we're talking about this emerging technologies, we also have to look at how easy and how accessible it is. So this is something that you have to see a clinician and have the indication for it. But again, with advancement in AI, technology, and molecular science, we're doing better. All right. We're going to talk briefly about 3D custom orthotics. So I'm a physical medicine and rehab physician. So we always talk about what else can we do to support musculoskeletal health. So people that have ankle issues, foot problems, knee problems, there's an advancement in technology of materials. So material science has evolved. So we can really mold things very easily, 3D print them to help individuals. And there's specific devices that are available on the market that can help provide orthotic solutions. Orthotics crafted using a 3D scan for a precise fit, correcting foot alignment and gait, and thus reducing musculoskeletal pain and postural issues. It's been shown to decrease foot pain and improve overall body alignment, benefiting knee, hip, and back issues. So this is something that's also available for people that have musculoskeletal problems and thus need pain relief. Now let's talk about virtual reality. This is something that many people are aware of. There's advancement of new technologies from iPhone and other things like that. So this is a way to also target the brain or change the perception of pain with these technologies. And there's a lot of literature supporting its use in back pain, neck pain, as well as cancer pain. So we're going to talk about those specifically, but there's multiple indications for virtual reality. There are specific brands out there that individuals can look into. Clinical trials have shown VR to be very effective in diminishing pain and anxiety, benefiting people who have burn issues, dental procedures, as well as chronic pain management. So the only thing that sometimes individuals may experience with virtual reality is potentially motion sickness. But overall, this is well studied. It's been studied in systematic reviews in neck pain. And in those contexts, there is moderate evidence that indicates that VR is a promising non-pharmacological method for reducing pain intensity in patients with neck and spinal pain. We still have to do some more research to understand how we can actually dose this for individuals as we move forward in getting better sense of how we manage pain. So in the future, or not so far in the future, when you go to the doctor's office, perhaps we may be prescribing VR to help you address pain and other emotional issues. We've also studied VR in cancer pain, and in those systematic reviews, there's actually 83% of the study shows effectiveness in VR in cancer pain, which cancer affects a lot of people, not just the disease itself, but the procedures that individuals have to go through. And all of those things, the procedures, the anxieties can be modulated by use of VR. And it can also improve people's emotional well-being in addition to their rehabilitation processes. Now we're going to talk about digital pain assessment and AI-powered diagnostic. So we also have to assess pain and what else, what type of technologies that are out there. And we're going to talk about two specifically. There's many things out there, but we're going to talk about Rupa Health as a platform for digital assessment of pain or underlying cause of pain. And we also talk about IBM Watson. In addition to all of those things, there is also pain assessment that individuals, platforms that people can use. One of those is called Pain Check, where it helps patients to track their pain, and that can be synced to the provider to help us to understand what's going on with the pain and provide specific strategies to measure objectively to address pain. So now, up to now, all of the things that we've been talking about, all of these technologies that we are talking about are really focusing on the sensory component of the pain, all the emotional component of the pain. But it's really not doing anything to understand why those signals are taking place. So when we talk about pain, a lot of the treatment that we have, even the things I've talked about, the pharmacotherapy, they are all blocking pain signal. But to really get rid of pain, we have to get to the root cause of what is driving the pain, what is perpetuating the pain state. And this is something that I talk to my patients quite a bit about. There is something that starts the pain, the inciting event. And most of the time, we understand what those things are. You had a fall, you had a car accident, something happened. But what keeps people in pain is very different from what starts the pain. And this is where we have to look at what is the underlying issue driving the pain. And this is where we have Rupa Health as a platform that actually has changed how we deliver care. And what it is, it gives patients and clinicians the ability to be able to understand some of this functional tests that needs to be done to understand people's level of inflammation, other markers of metabolic health, other mitochondrial health, and all of these things that actually takes place at the cellular level, including the microbiome, which is super, super important. And one of the things I've come to recognize as a physician who treats chronic pain is we always have to look at the microbiome. If nothing else is showing up on MRI and everything else is now, nothing else is working, it's a good idea to do that. So Rupa Health is a great digital delivery platform that actually allows us to understand the root causes of the problems that we are solving with all of these emerging technologies. So for providers, this is a one dashboard for all your labs. It's so simple. You go in, you put in the patient name, you put in an email, click, the labs goes to the patient goes, get the labs, they do it, they get the report back, comes back to you. It is connected to specific EMRs, or you may get an email for this. So this is a very great way and efficient way to really take care of patients. The first time I did this, I was quite blown away. And again, patients don't even have to be in a clinic. Kits get shipped to them wherever they are. So this allows us to really digitize healthcare delivery. It also democratizes it so people can have access to this. So this is a great way to help your patient, or if you're a patient, to ask your providers about how you can get some of this labs to understand what is driving your pain. Let's talk about AI-powered diagnostic tools. And this is an emerging field where we're going to be able to use AI to help us diagnose problems. And IBM Watson and other technologies are there, which is basically looking at a whole bunch of information to really help the clinicians to get a better understanding of the pain. Other technologies, this is in the realms of surgical intervention. So we also have deep brain stimulation as well as motor cortex stimulation that can be used to address cluster headaches and other issues. Obviously, this is a surgical intervention. So this is something that we have to weigh the risk and benefit. There's been multiple studies looking at this, and this has been shown to be effective. However, we do require large-scale trials and mechanistic studies needed to establish the safety and efficacy of deep brain stimulation as well as motor cortex stimulation. So again, as technology improve, as imaging technology improve, as ultrasound guidance improve, all of these things will become very safe to do to address pain outside of pharmacotherapy. Now we're going to talk briefly about regenerative medicine. Again, this is also an emerging technology. And what is different about regenerative medicine is the idea of really trying to go to the root source, especially when it comes to musculoskeletal issues. People have osteoarthritis of the shoulders, or they have rotator cuff tendinopathy, knee osteoarthritis. Some of these technologies, specifically stem cell, PRP, can really slow down the process of degradation and help bring people back. But again, there's a lot of research that's needed to really make sure that this is safe to do. Currently, when it comes to stem cells, specifically mesenchymal cell from umbilical cord, we can do that in the US, but there's other places outside of the US that have a lot of experience and a lot of advancement to do this. Again, this is an option that can be explored for individuals who have not been able to respond to the traditional treatment that we are talking about. So again, the whole idea of this presentation is to give patients options. A lot of times what I've seen in my practice that patients don't think that they have any other option outside of medications, injections, and surgery, but there is more. So hopefully this is helping you to understand the options that are available to you, and there is more coming. So the whole idea is you have to stay healthy, do the right things, the nutrition, the sleep, the exercise, managing stress. If you hang around long enough, you can intercept these technologies that are coming our way to help manage all of those things. Lastly, we're going to talk about augmented reality for physical therapy. And there is multiple things there that can be used to address pain. But again, rehabilitation is super, super important. And in fact, for me, being a rehab physician, this is something that I stress quite a bit. And all of the things that we've been talking about so far, whether it is VR, whether it's pain app, we still have to address the biomechanical deficits that happens with pain. So when you have pain for so long, not only is there pain that's ongoing, there's also musculoskeletal derangement. Your body adapts, your body adjusts and compensate when you have chronic pain. So there's always need to do physical therapy to strengthen muscles, because all of those other modalities are what we call passive modalities. So passive modalities are the medications, the injections, the VR, everything else we've talked about. But to really strengthen and heal, we need to also look into physical therapy. So there's augmented realities that can be used to help individuals do physical therapy. It is great. And there's been studies that's shown its effectiveness in addressing issues. And then the future development will aim to have home-based AR systems that therapists can use to guide and monitor patient exercises so people can do this safely, post-surgery, before surgery, and other things like that. There is also sensors and wearables that we can use in chronic pain. And in fact, there's been a systematic review, studies that look at all of those sensors and wearables that we have through our iPhone, other type systems. And this review showed that wearable sensor technology has been used mostly in adults, and we don't have a lot of studies in children, but that is coming because, in fact, young people are more adept to using technology than older people. But this is basically what the science show. So the study also showed that people will use specific things to monitor the emotion, capture lab setting, and among other technologies. And we also are able to collect some physiological data as well as activity data. One of the things that we want people to do when they have pain is to move. Sitting, not moving is very bad for pain. So having a way to really track your patient, encourage them, provide information, all of these technologies will help us with that. There are some challenges that comes with currently wearable, but again, as things are expanding, as things are improving, these are all things that we're going to be able to improve. So some of the challenges include weak correlation between sensor data and physiological measures, inconsistencies in data collection, and practical issues like data frequency and loss, with recommendations for future research to enhance all of these things. So this is, again, some other things that we can explore to help our patients with what's going on with them. And there is more is coming in terms of research that will allow us to be able to better serve our patient. So this is the end of our presentation. And the conclusions that we have for these things that we've talked about, that emerging technologies provide an effective treatment option for patients with chronic back pain, migraines, fibromyalgia, and even rheumatoid arthritis. And these are relatively safe. And the great thing is that this technology really empowers the patient who is in pain to control the pain or manage the pain before the pain manages you. Because one of the things that comes very difficult to do is that pain is a subjective experience. So you, the subject, patient, having the capacity, the empowerment to be able to manage their pain with some of these tools without going to the doctor's office or without going to the hospital, which sometimes can be itself anxious provoking or even create more problems, is a great thing that we need to have in place for our patient. We also have to recognize that pain is a complex phenomenon, and that requires multiple modalities to really assess it. We have to look at multiple lenses. We have to look at what's going on at the cellular level. We have to assess function. How is pain implicating people's ability to function, to walk, to do the things they want to do? We have to look at the neuroaffective component of pain. pain also implicates the brain. There's emotional component of pain. And how do we also look through that lens to make sure that we are getting hold of everything else? And then we also have to look at the inflammatory cascade. So the goal of this presentation is we have all of these tools that we can use, but beyond that, we really have to take different lenses. And one of the ways we can do that is really going to the root cause cellular level. And this is where this platform, Rupa Health, I've talked about, can give you, the clinician or even the patient, a way to really understand what's going on within your patient, understanding inflammatory status, understanding hormonal status, understanding HPA axis dysregulation. This is your stress response. Stress is connected to pain, cortisol, understanding other deficiencies in nutrients, B vitamins, and other things that can implicate neuropathic pain or nerve pain. So we have to look a little deeper when it comes to pain. And we also, at the end of all of this, we have to focus on health as a way to solve pain. So one of the things our practice do, or I tell my patient, is we are focusing on health as a way to solve pain. And how do we get to health? We have to signal the cell in a healthy way. And it becomes a function of optimizing sleep, exercise, managing stress, bringing cortisol down, nutrition. All of that with good habits gets us better results. Hope this is helpful, and look forward to providing more education and sharing more as more technologies come up to help our patients. Thank you.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.